Hey guys, welcome to the Averity Insurance Podcast, episode 3.
Episode 3.
We're excited to be back once again. With my famous partner, Natalie. And I'm myself, Louis. We're part of Averity Insurance. We're the owners of Averity Insurance. So let's go ahead and get right into it.
Yeah, so today's episode, we're going to be talking about the touchy subject of fraud, waste, and abuse in the U.S. We're going to go everything from Medicare fraud, Medicaid fraud, ACA fraud, and basically just how you can protect yourself and basically to see what the government is doing moving forward. Mm-hmm. So let's dive in. So the first one that we're going to talk about is Medicare fraud. So for those of you that don't know what Medicare is the health insurance program that is for 65 and older. For our senior citizens, technically we're paying for it. It's coming out of our checks. It's coming out of our taxes.
Yeah, if you work a W-2 salary job, you'll see like somewhere in your pay stub, they'll say Medicare tax, and then you'll see the amount that they're deducting.
So Medicare is a program that most citizens, once they retire, they are eligible for, and Medicare over the years has increasingly. The fraud has just been overwhelming. So some stats that I wanted to, bring to light. Some of the scams, some of the fraud might be doctors billing for services that were never rendered. Mm-hmm. Doctors billing for durable medical equipment like wheelchairs, orthotics, braces, things that were never
and they never actually
never rendered, mm-hmm. right? And to give you an example. In 2022, 35 individuals across 5 states, including the doctors, submitted fake claims for DME, durable medical equipment, and they did a whopping $1.2 billion of fraud.
These are billion, right?
Billion, like $1 billion of fraud. Wow. And so, again, this just makes insurance as a whole look very, very bad. And it also makes the really good doctors lose their credibility.
I mean, ever since we first started, how many times have they told us about like stuff like that?
Yeah.
And I think living in Miami, we become a little bit like desensitized to it.
Because we see it a lot.
We see it a lot.
Yeah.
But when you put the numbers out there, like it's actually pretty crazy. I mean, how you say 1.2 billion?
1.2 billion.
It's not a million. It's a billion. So it's actually kind of ridiculous how many people are still doing this to this day and age. And when did Medicare start? It was like
Medicare started in 1995 or
something like that. I remember when we looked it over.
We looked it up a few days ago.
It's only been
30 years or so, 30 years
more or less. So it's like for those 30 years since the beginning, they've been doing that.
As a matter of fact, reading here, Medicare loses $60 billion a year due to fraud, waste, and abuse. Yeah. So when they say fraud, waste, and abuse, fraud being fraud, it's self-explanatory. Waste is when providers are billing for unnecessary services. Mm-hmm. So they're ordering exams, they're ordering labs, ordering things that
they never
are not really needed. Mm-hmm. The person didn't ask for them. They don't really need it. They're just billing for them because they know that
sometimes they actually get it done.
Of course.
But is it necessary?
Is it necessary?
Multiple times and stuff like that. That's when it starts getting.
I had a client actually tell me earlier this year that her mom had 6 surgeries in 1 year.
Wow.
Were they all medically necessary? Who knows? But to play with someone's life like that is absolutely wild.
Yeah, I mean, how many times? That's ridiculous. I mean, 6 times for a surgery, you would think that. I mean, I would expect it to be fixed the first time,
right?
Unless it's something like that's out of the ordinary that it keeps happening over and over again. That makes sense. But if it's something that
6 times in 1 year is absolutely crazy.
If it should, I mean, it should only be done once. Yeah, and that's it. Fixed once.
I mean, imagine the body can't handle even so much anesthesia, regardless.
Exactly.
But it's crazy. So Medicare is for 65 and older. So Medicare typically targets the senior citizens, which is our most vulnerable community. If you haven't noticed, I'm sure you know because you live here and we see it and we talk about it all the time. But if you're watching this and you live in Miami, I'm sure that you guys have noticed that there are medical centers popping up on every left and right corner. Restaurants are being torn down, and then new medical centers are being implemented right in those same places.
And if it's not a restaurant, it's a warehouse.
Exactly.
Like right next to a warehouse district.
Exactly. And the thing is that I mean, granted, doctors, they all need their jobs, right? But nowadays they're not looked at like medical centers. They're looked at as a business. They're looked at like mills. They're called Medicare mills. And Medicare mills are essentially just bringing in patients and just billing and billing and billing and billing and billing, because they know that they're going to make money. Like, they're going to make money. They know that Medicare is going to pay out all these services.
But you would think that Medicare will put a stop to it, like, to a certain limit. Like, how many times something can be billed, you get me?
Right.
Without showing actual proof of the actual work being done.
But how would they show proof?
I don't know.
I mean, their proof is essentially the doctor's notes.
Yeah, but
that is their proof. You know, it's not like they're going to take a picture of the patient in the room and send it in. You know what I mean? I mean, could they? I mean, I don't know.
I mean, it gets to a certain point. How are you going to bill like that many millions of dollars, and then you're not going to be able to show proof for it?
Yeah.
Or just a simple piece of paper of a doctor writing it. I understand, because the doctors are supposed to be held up to a higher standard.
Yeah.
Right. That's their job. But
greed takes over.
Yeah.
Greed takes over. I feel like any being in any type of profession for that long, for 20, 30 years, I'm sure that over time it loses that touch. It loses that love for the passion. So it goes from being, I want to help people, to now I want to get money. Yeah. Like, now it's just all about the money.
I'm sure it gets to a certain point where the hours are long. They feel long. They feel like they're stagnant. They're not growing. And then, but I don't think it should result to that, though.
No. You know, I mean, because we're good people.
I mean, if you really feel like it's not the right thing to do, then just, you know, either pull through it, or find something else to do, or like get creative with other things that you could possibly do. Especially here in Miami nowadays, med spas are popular. Yeah, and you can start looking into that as if you're a doctor, of course. Yeah. I'm not saying like just anyone, but like med spas are the new thing here in Miami. Yeah. So if you feel like you're not making money as a regular doctor, look at other opportunities to grow.
Yeah, I mean, you're right. Essentially, these centers that target these senior citizens are incentivizing them to come in. They incentivize them with like grocery gift cards. They offer them Publix gift cards, you know, whatever. Hey, come do your annual physical with us. Come see us. We actually know one center, I'm obviously not going to say the name, but this one center is incentivizing their patients $100 a month. And you know this, you know which center I'm talking about. They offer them $100 a month to come in and be their patient. Yeah. And of course, our senior citizens have a retirement of $500, $600, $700 a month. They can't live off that. Yeah. Who can live off that? Exactly. So they appreciate that, and they will go wherever the money is, you know? Exactly. And in their eyes, it's not fraud. In their eyes, it's not waste. In their eyes, it's assistance, you know? So it's masked and very, very nice.
At their age, with a $600, $700, you know, fixed income, that's something for them. You get me? And not a lot of people, especially here in Miami, for $700, $800 rent, you're living in an efficiency. Not even. It has to be like a shack in the middle of like Hialeah. Yeah, like it's ridiculous, and I don't think that's fair for the seniors. You get me?
Yeah, specifically for Medicare fraud, just so you know some details or some facts. There's been at least 100 arrests in the last decade tied to Medicare schemes. Mm-hmm. The FBI building that was built over there off 75 was built solely to target Medicare fraud. Yeah. So the FBI literally built a whole headquarters here.
Just to tackle fraud.
Just to tackle fraud. Another real example.
And it goes to show how long ago was that?
They probably built that 5 years ago.
That was a while back. Yeah. Do you think it was 5 years ago?
Around there.
I think it was
more or less.
Longer. So maybe
a little bit more.
I mean, that goes to show how much there possibly is. Yeah, especially here.
Another real example. A Miami man sentenced in 2022 for running a sham senior medical center that billed $20 million to Medicare for bogus home health services. So bogus home health services meaning like they billed that they went to the patient's house and they rendered services that were never performed. Exactly. And because they're not even...
How do you get that far?
How do you get proof for that? You know, what are you going to do? Record the person's home? Record you, like, take a selfie in their person's house? Like,
I mean, if it gets to a certain point...
What extent do they have to go to? Maybe they'll start wearing, like, body cameras or something. I don't know.
Who knows?
So those are all the medical mills that are billing and taking down Medicare. Essentially, most likely by the time that we hit 65,
it's not going to exist.
Medicare is going to run out of money.
No.
You're talking about $60 billion a year Like by the time we retire, Medicare's not going to exist, and there's going to be a whole other program probably implemented. And this really, it breaks my heart because, again, the senior citizens are the ones that are targeted, and it makes the good doctors and the good insurance brokers and the good insurance companies lose credibility 100%. The next thing that we wanted to discuss is Medicaid fraud. So not to be confused, if you want to go into the difference of Medicaid and Medicare.
Yeah, so Medicaid is for people that have low resources, low income, and it's based off of their need. So there's people out there that are actually, what's it called? They maybe get paid in cash and they don't file any taxes, and then they just go ahead and they leech off the government. So getting free food stamps, getting disability checks for things that they probably don't even have. And I'm sure you've seen it yourself where like you're at a grocery store, especially here in Miami, that this guy is wearing a gold chain. You know, drives a brand new Toyota Camry, whatever it is, and he's at the grocery store pulling out a food stamp card. Or the gold.
Or I've even
Medicaid
seen like
card.
I'm talking about luxury cars, G-Wagons.
I'm saying Toyota Camry just to be nice. I'm saying you get me, but I'm sure there's other people out there that even have more than that. And again, Medicaid is something for the people need it. This is an actual help for people to get back up on their feet. And then once you're off their feet, they have to get off of that. But people take that to their advantage, and then they want to just ride it out as long as possible, you know, get the food stamps. And then that's where the waste comes into play, that there's just this money that could be given to someone else that actually qualifies it. And you know, they just take advantage of it. And how many times, especially as far as, then this ties both into Medicare and Medicaid, as far as like, you know, my own grandpa, before he passed away, and they raised his Social Security check $20, and that bumped him over the Medicaid level, over the Medicaid threshold, and they took away his Medicaid. So this means that for those of you that don't know, when you have Medicare and Medicaid together, you don't have to pay the Medicare Part B premium, which is $184. $20 bump. It pushed him over the limit, took away his Medicaid benefits, and then $184 on top.
So they raised his retirement benefit by $20,
but they took away,
pushed him over the edge to qualify for Medicaid. So now they're going to take away $184.
So then he lost all his Medicaid benefits with his Medicare Advantage plan. All his co-payments went up. His medications went up. I mean, and how do you expect someone to live like that?
Which is
really
a
$20 difference. You get me? And
is it really a $20 difference though? Because now it became a
$160 difference.
More than that.
$160 loss. Just for that $20 increase. You know? So it's like, those are the people that actually need it. Unfortunately, like that whole income level, you know, just that little small amount pushing him over the limit. He could barely afford to live on his own. You know? Before he passed away, like that's crazy.
And like there's people, like Louis said, there's people out there that have, you know, brand new cars and gold chains and luxury purses or brand name purses and all that stuff, and you see them literally with a gold Medicaid card, and I'm like, this doesn't make sense. You are perfectly capable of paying for
you got four limbs, plan. You got arms, you got legs,
you're perfectly capable of working, of paying for your insurance. Also, you don't even have to be in Medicaid. You can literally jump into the marketplace and pay $30 for your plan. But because people would rather milk the government and take the free way out, they will falsely report their income, extend these Medicaid benefits, not just to them, but also to their family members. And then again, like the people that actually really need it are the ones that suffer, which completely sucks. So to give you some numbers, an audit in California that was done about 2 years ago found that 17% of Medicaid enrollees were likely ineligible based on income or residency. And the worst part is that the government doesn't have the supplies, or they don't have the tools to deep dive into the eligibility. Like they don't have the materials to really decipher if the person really qualifies or not.
I mean, at the end of the day, like, that's their decision. I'm sure they have, where there's a will, there's a way. Right?
I mean, again, $60 billion a year in Medicare waste is...
I know, it's crazy.
They got to pull back somewhere.
But there has to be some sort of limit, some cutoff point as to, like, no, not everyone can apply for this.
As far as we know, to apply for Medicaid, they even ask you for your account and routing. So a lot of the times they will go into your account to see what you have.
They have the financial release form. You're right.
Yeah, they have a financial release form.
And they only ask for one account.
So what if people have things
Multiple
in cash,
accounts.
multiple accounts? That's how they get away with it.
Of course, exactly. They have all these cash accounts, and then they don't put anything into their
and
own
it's
account.
The government essentially.
They might put a few dollars in just to show like they have something coming in, but low enough to not have them lose the level.
Yeah,
that makes sense.
And like essentially, it is the government. They should be able to see everything. So it really, like you're right. They have the power. They may just, I don't know. Maybe they just don't know. I'm sure they know, but I don't know. It gets really
turn a blind eye to?
It gets really questionable at this point. So yeah, this Medicaid fraud, and the same thing goes with the providers. The providers will also bill Medicaid and bill for unnecessary services and for services that may have not been rendered.
Yeah.
Unnecessary labs, unnecessary exams, unnecessary x-rays.
And it applies to all insurance, I feel.
That were never really needed. Mm-hmm. To give you another number, Medicaid loses $36 billion a year. So if you combine those numbers in between Medicare and Medicaid,
almost $100 billion.
They're losing $96 billion a year. Billion with a B. $96 billion a year is lost by Medicare and Medicaid every year. Yeah. And guess whose pocket that comes out of?
We have to pay it.
Our pockets. So going on to the next one is ACA fraud. So what is ACA? ACA is the marketplace. So it is reported.
For those of you that know it as Obamacare.
Yeah, otherwise known as Obamacare, formerly known as Obamacare. They actually just released a notice that you got the same email. They apparently reported $20 billion lost last year as well. Mm-hmm. So
in between those three, you're over $100 billion.
Over $120 billion. Mm-hmm. Yeah, for sure. And the reason that there was fraud was because there was ghost enrollments, people that were being enrolled twice or three times. They had multiple applications receiving multiple tax credits. How many
times have you tried to help someone out and then you see 2 or 3 different applications same year?
Yeah.
And then 2 or 3 applications.
They'll have multiple different agents.
Maybe different addresses, maybe different date of births. Yeah. Or not different date of births, but same date of birth, different addresses.
Yeah.
And then multiple applications available. So they're giving double or triple the tax credit each month to help pay for the insurance.
And that's where the fraud comes from. That's where the waste comes from.
And that mainly comes from those agents that are falsely advertising.
Yeah.
And I'm sure I think you mentioned it before in one of the episodes. If not, people just think that it's okay to mislead people.
Yeah.
If you ever see anything that says, get a free Visa gift card for signing up for health insurance, it's completely fake. BS.
It's a scam.
It's not true. Your subsidy is for the insurance, like for the premium of the monthly premium. So that's why you might see someone paying $10 a month, $0 depending on that person's income. But it's not for you to buy food or rent or any of that stuff.
I'm actually looking right here. It says in Texas, an investigation found hundreds of ACA enrollees had fake income and employer documents created by a broker ring. So essentially, it was a group of insurance brokers, right? Like ourselves. This is what gives us a bad rep. They were enrolling hundreds, if not thousands, of ACA people with fake income, fake papers, fake employer documents, fake everything, which ties into that $12 billion or $20 billion that are lost every year. And last year, they did over 5 million people were victims of dual enrollments and being enrolled without their consent. Just so many things, and again, that just goes into the fraud, waste, and abuse. Mm-hmm. The abuse is kind of all of it.
And that's why it's so important, especially like for those agents and those brokers watching this, like getting those consent forms and having them sign it. Yeah. It might be a little bit more extra work, but it's for the long run. If you really want to be an insurance broker for the long run, those are the type of things that you have to be doing, and it is what it is. Unfortunately, those people that ruined it. Yeah. Those people that are doing the duplicate applications, the falsifying enrollments and stuff like that, those are the people that ruin it for everyone else.
Yeah.
You get me?
And it sucks because, again, the people that need it, the people that really need the help are the ones that aren't getting the help that they need.
Exactly.
But yeah, I mean, moving forward, what is the government doing about this? I mean, again, Miami, Houston, and LA are like one of the top 3 cities of Medicare fraud. So they are doing what's called Medicare strike forces in those areas. So they basically create a task force to try to tackle the Medicare fraud. Apparently CMS is now also, CMS being Centers of Medicare and Medicaid Services, is now apparently using AI and predictive analytics to spot irregular billing patterns.
Wow.
Irregular billing patterns being, they're starting to see multiple duplicate billings, billing and procedures that just don't make sense. This year, the marketplace has really tightened up as far as when it comes to eligibility verification. They're requiring agents and brokers to submit proof if the person needs to enroll. They're no longer letting people enroll that don't have social security numbers. So like you need a social security to enroll. And they're doing stricter consequences apparently for provider collusion, because believe it or not, there is a lot of provider collusion. And what that means is the doctors are getting involved with the fraud. And nowadays, like we were talking about earlier, it's not just the doctors that are owning these medical centers. It's regular business people that want in on the fraud. They're like,
I remember there used to be a medical, it wasn't a medical center. It was a dental clinic that guy just owned it, but he's not a dentist.
Yeah.
He's just a business owner.
So he
just bought it, and then he just created the whole, I don't know if he's still around, but I remember like it's crazy. Like that's a regular business opportunity. Regular businessman just buying business opportunities.
The one that opened up in Hialeah, the one that we went to, that guy had no experience in medical history. He was just a business owner.
Right.
And we met him and we were like, this guy wants in on the money.
How about no?
Yeah. We got a little fishy vibe from him, so we never went back. But a way that the members, a way that regular consumers like you guys can protect yourself is reviewing your explanation of benefits, because there's a lot of people that we've seen get random bills for services that they were never rendered for. Like you were giving me an example the other day where one of your clients got billed for a service out in Texas, and the guy's never been in Texas.
That's right.
Like, what do you mean he got a bill from a doctor's office in Texas and the guy's never stepped foot in Texas?
He's got Florida insurance.
And he has a Florida insurance, which
Florida insurance. So
crazy.
When he calls me, he's like, or he sent me a screenshot. He's like, what is this? And I'm like,
this is
you in Texas? I'm like, are you in Texas? Did you go to the emergency room in Texas? He's like, dude, I'm at the shop. He's
like I'm in Miami.
Yeah, he's like, I'm here. I'm working. Like, what is this? And I'm like,
that's crazy.
I have no idea what to tell you.
That's crazy.
You know?
Yeah, so I just encourage you guys to review your explanation of benefits. What that means is every time you go to the doctor, every time you go to the hospital, every time you get an x-ray, therapy, labs, you will get a letter that is called an EOB, explanation of benefits, that shows you what you had done, and it shows you how the insurance covered it, what they were billed, and what they paid.
Exactly.
So make sure you review your medical history, make sure you review your explanation of benefits, and all of that also ties into the MIB, and that's something that we were talking about before. Everything reports back to the Medical Insurance Bureau, or Medical Information Bureau, which is a department. I like to call it like the FBI.
Yeah, ever since you were younger until the age that you're watching this, they have all your medical history. So they can see literally everything. And they'll ask you, like, let's say if you're going to apply for like a life insurance or something, they'll tell you, what did you do on this specific date? And you're supposed to remember it. But who remembers what
so they will deep dive and they will pull up records from 10, 15 years ago. So if there is something in your chart that wasn't supposed to be, you have to make sure that that gets removed or that gets taken off, because that could affect you way later on, especially when, like he said, applying for like a life insurance or something like that. So fraud, waste, and abuse cost tens of billions of dollars. And it's definitely affecting not only us as everyday consumers, it affects patients, it affects the good doctors that work with integrity, it affects us as insurance brokers, it affects the insurance companies themselves. And at the end of the day, we're all paying for it. Yeah. So I just encourage you guys to keep an eye out and beware. Just beware.
Yeah.
So we can wrap it up from here. Yeah. We've already been going a little over time. So thank you guys for tuning in, and stay tuned for our next episode.
I'll see you guys there. Make sure you guys like, subscribe, comment.
Oh yeah, all of those buttons at the bottom.
In the bottom on YouTube.
Let us know what you want to see next.
And we'll see you in the next one, all right?
Bye.